Hi everyone. For this video, we are going to cover on a subject that is relatively close to heart these days, which is it's got to do with the aging population trend in Singapore. So based on some simple statistics, right? In 2010, 1 out of 10 individuals, all right, are actually an elderly. And as the statistics move on to 2020, it was 1 in 6. And forecasted in 2030, we will actually be seeing 1 out of 4 individuals who is an elderly. So with this aging population trend, it is something that sparks concerns among Singaporeans or residents staying in Singapore. So Dylan, what do you think is the causes to this aging population currently in Singapore?
I think it's a prevailing concern, and it's a social concern that generally the government is actually taking a very putting a spotlight on as well in Singapore itself. So one of a few reasons is of course primarily I think generally we are living longer as well. Life expectancy, with time itself, where the society as a whole is becoming more affluent. Generally, we take better care of ourselves because intellectually we are also more aware in terms of the need to, as well as with the advancing of medical technology as well.
Right.
So that also actually prolong lives. So even if you are down with illnesses itself, sometimes your health expectancy might be lengthened, even though and of course, there's also a declining birth rates in Singapore as well. So that's also one moving trend as well. So a declining birth rate is because because of the society itself. Generally, we are more prioritizing our career over creating a family nucleus itself. So I think that also will have a longer term impact as well. So now these days people are getting married later in life.
Yes.
And then of course sometimes even married couples itself are also delaying their decision to actually have a child at a younger age, because they put, even if they're married, they might actually prioritize their career first before and because of the moving trend, that the fact that we are a society that back in those days itself, generally there's this social society trend that the man is working while the wife priority is actually to care for the children back at home. But these days that's no longer the case. So instead of back in those days where a single income can actually feed a family of 5 to 10, these days even just to feed each themselves, I mean, like this itself, you need both spouse be actually working, so dual income just to feed 2 mouths. So that's the situation that we are facing these days, because rising costs as well with inflation and all these things, and the fact that Singapore being a first world society itself, the cost of living is really substantial. So that also put into factors consideration as well when people think about expanding their family nucleus. A lot more consideration have to be put into place.
Yep.
And of course, with the trend of a declining immigration as well, back in those days, we do have a bit more foreigners foreign workers coming in to help build up the population size itself.
Yep.
And then with recent measures itself, there is a recent trend as well, in terms of declining populations or immigrations into Singapore itself to actually contribute to our populations. So that has an impact as well in terms of the longer term trend of our population itself, and the labour and market and retirement policies as well. So the fact that government is actually encouraging the elderly to actually work longer, so I think that has an impact as well in terms of how this is shifting, because we do see that our retirement age, from statutory retirement age, has been moving backwards in recent times as well. So that's also one of the labour and economic implications as well for aging population, and how the government is actually doing things and moving the age band for retirement. So that's one consideration as well. And of course, lower fertility rates are I do not know whether it's because of work stress and all these things, and of course the fact that couples, spouses themselves, are also working as well. I think to a certain extent also contribute to the lower fertility rate, and the ratio in fact right now is not enough to actually replace the aging population. So I mean, back in those days, I mean, like during the generation before us and 2 generations before us, we do have a bigger family nucleus of
yes, definitely.
5 children, 10 children. But these days, I mean, like honestly, even for myself, I only have 1 child. So I mean, like that ratio, I mean, like it's not sufficient to actually replace the young population to actually replace the older generation, because what happened is that to effectively replace the population itself is actually every family of 2, they need to have 2 children. So I think this is a trend that that we're seeing in Singapore itself, which is 2:1. So that's not enough. So that also contributes towards aging population. That's of concern today. Yeah.
Yes.
So Daniel, for yourself, right, how do you think the government is actually addressing this aging population?
Right. So with regards to this, personally, from my observations, I've seen some initiatives from the government in terms of coming from the infrastructures. The government is setting up more nursing care, hospice services.
Yes.
And if you were to observe around our new HDB estates, right, you not only you will see more childcare centers and infant care centers, you also do see elderly care facilities as well,
right,
as well as rehab centers very conveniently within our HDB proximity.
Correct.
So these are some of the initiatives. I mean, structurally that I'm seeing that is notably very different growing up during the 90s or even the 2000s. In terms of policies wise, I've seen the government bodies or initiatives like active aging, encouraging active aging for our elderly in Singapore. Of course, in terms of social services funding by the government, personally, I've come into contact with these programs as well through the clients I work with, or even my immediate family members. Fundings generally for elderlies, and through AIC, this government body, and if for those families who are generally lower in income, there are other financing schemes that's available for them to explore as well.
Okay.
So with that, this is what I observed of the initiative that the government is focusing a lot on. But with this thing in place, right, it inevitably will contribute eventually towards our healthcare services, funding for our healthcare services, which does affect generally our retirement planning as well.
Yes.
So over to you, Dylan. What do you think this aging population effects, right, will affect our healthcare system?
Okay, so for our healthcare system, right, I mean, like generally the structures are more or less, there's some form of structures in place already, but of course there are also initiatives that are there to actually address the aging population in Singapore itself. Like recently, if you're aware, there's this thing called Casio Life. So this is something that back in decades ago, when government came in with this long-term care insurance called Casio Elder Shield. It was actually for the population for 40 years old and onwards. So that was the initiative about two over decades ago. So and in recent times, in 2020 itself, the government actually introduced this healthcare long-term care insurance called Casio Life, with the objective of making sure that there's a wider pool of the population that are actually uncovered under this new scheme itself. So those that is 30 years and above, like us itself, basically we will be automatically enrolled under this new Casio Life scheme, to ensure that in time to come, where long-term care is actually required, there's something in place. There's a healthcare, there's some long-term care insurance in place to actually help to alleviate the burdens of the families and individuals that actually requires long-term care. So that's one area that and of course I think that we will also have to be aware that these days the government is also encouraging there's a lot of preventive measures as well, encouraging the population to take up a more active lifestyle and a bit more health conscious as well, because when we talk about aging population, one of the issues that will surface is that with age our health will be at some point compromised as well.
Yeah.
So preventive measures is very important as well. So with the aging population, one thing is that we try to make sure that we try to stay healthy, maintaining a healthy lifestyle as long as possible, because I think in any individuals, our body at some point will fail us if we don't maintain and take great care of it. So it's not necessary aging means weakening of your capacity physically or mentally. So I think some of the health concern that will come with age naturally is medical conditions like dementia, which is of a great concern, as well as diabetes as well. So that is also some things that the government has actually put in place to encourage individuals to maintain a healthy lifestyle in terms of your food intake, in terms of activities that you do. Make sure that you are more active in in the society itself, so that you maintain your mental and physical well-being for as long as possible, even with age. So I think that's important. And beyond that itself, I think it's increasing in terms of the facilities as well across Singapore to actually address that. Community hospitals, there's more and more polyclinics I observe as well in especially estates where there are a bit more older populations. Then I do see that more and more of such facilities are in place, or are going to be in place. So this will also help to address, alleviate some of the healthcare burden of hospitals as well, because if it's just minor illness itself, or from the aging population itself, they can actually go to these areas of convenience where the polyclinics is just within the proximity of your home itself to actually address it. So that's something that of course there will also, and then with technology as well, I think that's one thing that these days there's also teledocs and all this telecommunications, so even if for the convenience of the population itself, there's also technology in place where rather than for those minor daily ailments, right, like your flu, cough and whatever, rather than having to overload the facilities, the healthcare facilities in Singapore, you can actually conference with the doctors itself to actually address this. Because with age itself is natural, there are more things that will pop out, and sometimes it might not be something severe enough for you to warrant traveling all the way to healthcare facilities to actually address that, because it can be done at the convenience of your home, and because of age as well, because I mean honestly, with age itself, traveling from point A to point B itself is also something a bit more of a challenge.
Yeah.
So that also requires you to actually be a bit more at the place at your convenience. I think that's important. So and of course social workers also play a part in terms of the social compactness of aging population itself, being able to outreach to more people as well, because beyond the healthcare workers itself, the social workers also play a part in terms of reaching out to this group itself that is a bit more vulnerable, that's a bit more dependent, and these social workers also in place to actually provide a subsidiary outreach to the population itself. So for you, Daniel, what do you think is the implication of an aging population on the economy and the labour market?
My take on this is that with aging population, inevitably in time to come, it will likely cause GDP to actually slow down, which I think government policies is trying to address this as well. So which is why we are also constantly the country or the government is constantly coming up with policies or to refine our policies to balance the working force of our foreigners or the foreign talent in that aspect. With a slowing economy growth, that will in time to come, that will definitely put a strain in terms of the working population, the working force, to actually contribute, to in terms of tax paying towards these government social funding programs, and you will actually take a strain or in terms of the budget on these programs as well.
Okay.
So which is why if you were to observe, I think the government is really upping up their voices and the initiatives, all right, to call for Singaporeans to start planning early for ourselves, especially for retirement.
Yes.
Now the thing is, for retirement, one of the experience that I have with people whom I spoke to or individuals that I work with is that when they plan for their retirement, they focus a lot on the lifestyle.
Okay.
Which is normal.
Yes.
But however, with this cause of our aging population, knowing slower GDP growth,
Yes.
straining of the budget,
Yes.
one of the key elements, which is the healthcare cost, needs to actually take more position in terms of the financing part, in terms of the our retirement planning or retirement programs. Yeah. So the other thing which I will deviate slightly, right, is also because for those that is not currently aware, one of the good things which I note is that the government has also implement some legal system for our caregivers, because caregivers does take on certain amount of stress in providing caregiving for elderly in Singapore. So one good thing is that the government has come up with a legal framework, right, for elderly to be able to decide and give certain powers to the caregivers to make certain decisions for them in the event of any form of mental capacity. So which comes in the form of the LPA. Yeah, so this is something to actually take note as well.
Yes.
Yeah, so with that, right, Dylan, what do you think beyond just merely staying alive? In terms of mental health, psychological well-being, in the sense of community nursing home setting, do you think that is adequately addressed in Singapore at the moment?
I think at this moment in time, I mean, I think ultimately, right, when we talk about these areas in nursing home, because with aging population, right, I think the sense of community within these vulnerable groups, I think at this moment in time, because of the healthcare workforce itself, right, I think that there's room for improvement, definitely, because I mean, like, honestly, yes, we talk about a lot of times when we look at this, right, we are thinking in the perspective of the caregiver. So maybe the children might be the caregiver, trying to free up the time for the caregivers, so that by putting them in the nursing homes, it does allow the caregiver to continue to focus on work, focus on the career itself. But a lot of time we didn't put thoughts into the individuals, the vulnerable individuals that actually in the healthcare facilities itself, in a nursing home itself, because I mean, ultimately we have to be conscious they are human beings with emotions as well, with a sense of having beyond just taking care of my daily needs, like food, cleanliness, and beyond that itself, medication and all this. Beyond that itself, I think what's important is also to be conscious that these people are lonely as well. Okay, they are being, although they are in a facilities where they are surrounded by people that are similar to them, vulnerables, but at the same time, I believe they will have definitely, I mean, as human beings, we are longing towards being together with our family members, being with them, and sometimes itself, because of the fact that there's a lot of focus on the basic needs itself, we tend to neglect the mental health of the individuals within the settings itself. And a lot of time, because of the volume of vulnerables that's in all these nursing homes, right, sometimes they might not be given the tender loving care that they might need, because of the ratios of the patients, or the vulnerables to the ratio of the working staff, the healthcare workers that's actually attending to them. So they are vulnerable. They need more attention, not just on their basic needs, but also on their well-beings and mental well-beings itself. I think they might be lacking that, because the truth is there's not enough to actually address that and to attend to that itself. So I think that is something that we have to be aware of, because of course it's important actually to actually have this mental health services as well, so that there's some counseling on all these individuals as well, which I think at this moment in time is still something that is there, but not sufficient at the moment in time to actually address the counseling for the individuals, the vulnerables in these settings itself. And for that itself, of course, I think it's important to also try to make an effort to actually integrate them back into the wider society as well.
Right, yes.
Because a lot of times when we talk about nursing homes itself, the individuals there, sometimes they are, once they are put in this setting and it was transfixed in this setting itself, sometimes it's very hard for them to be reintegrated back into the society. So that's also something of a concern as well, because I mean, like, if you are there must be motivation for you to actually take initiative to care for yourself, to take effort to actually encourage the family members as well to actually reintegrate the vulnerables back into the family setting as well, if it's possible. So that is one area that I feel that can be better. And of course, dementia care as well, because I did highlight the earlier section itself, that this is also one area that's a bit challenging, because with and the thing is that although we are increasing in all these healthcare facilities, including nursing homes, right, there's a problems of the fact that our dementia within the population is not a linear curve up, but it's an exponential curve up. And the fact that our healthcare facilities is basically a linear growth, so that might at some point there will be insufficient nursing homes to actually address to this group of vulnerables who suffers from dementias, and probably will need to be put into a nursing home because family members are short-handed and they need this. So in that areas of I think government wise, the society as a whole wise, I think we have to be prepared for that, because otherwise in time to come, I will believe that it will become a significant social issues. So yeah.
So with that, to actually sum up this video, with regards to the aging population and the impact of having an aging population, is a complex subject to actually talk about. But nonetheless, precisely is because it is a complex subject to actually talk about. We are trying to generate this awareness, in terms of what is actually happening, so that you are able to have conversations with your family members or even people around you with regards to this subject, to take on a more key highlighted point for discussion. Now, in terms of financing, the financing portion, which has got to do with your retirement planning, it is good to start it early and start talking to your advisors or consultants early, and when you're planning out structurally your retirement plans, to pay more attention towards the healthcare financing portion as well. Now, the other aspect, which is more of the caregiving part. So as we age subsequently, likely we will require someone or caregiver to be taking care of us. So if you were to talk about this earlier and decide at a certain point, all right, who will be a caregiver, and to assign some power to this caregiver makes things much easier, right, in the event of such an unfortunate situations were to actually occur. And that's for our LPA. So with that, we will actually sum up this video. If you feel that the content has helped you or benefited you, do feel free to like this video, and remember to look for the bell icon and click subscribe, so that you will get to enjoy more of our further contents and videos.
And feel free to comment in the section below.
Yep.
Yes.
Yep. See you in the next. See ya. Bye bye.
See you. Bye bye.